Welcome to the podcast, Medicine Untold, and come with me on a journey to the unexplored side of medicine, where we speak with rebel doctors, radical herbalists, unorthodox healers, and patients who have healed themselves. Explore the intersection between science and spirituality, and discover the power within you. I'm your host, Dr. Michelle Berkland, licensed naturopathic doctor, botanical alchemist, and practicing physician. Welcome, everyone. Today we have Dr. Katherine Willow with us. So welcome, Katherine. Dr. Willow is a fourth-generation naturopathic doctor with over 4 decades of experience. She is the founder and director of Carp Ridge Eco Wellness Center near Ottawa, Canada, which encompasses 190 acres and hosts North America's first forest school. The focus of the center is a holistic mind-body medicine clinic and programs that teach healing principles. Dr. Willow integrates German New Medicine, or GNM, into her practice. In this new paradigm, one can connect biological shocks with conditions and determine whether a person's symptoms are in the stress or healing phase. Her current goal is to develop one of the best mind-body medicine clinics on the planet. Dr. Willow integrates Dr. Hammer's discoveries about how we get sick and how we heal with naturopathic medicine, Ayurveda, and mainstream diagnostics and treatments in the context of spiritual principles to create effective and realistic healing programs. So thank you so much, Dr. Willow, for coming on today. And I'm excited to hear so much more about mind-body medicine. And I feel that my beliefs and the way I want to practice is very in tune with this, and getting more information out there of German New Medicine, I think is an amazing thing to do for our audience today. So welcome.
Great. Thank you for inviting me. I'll just preface this by saying that I think that this material is like the world is round and not flat for medicine. That's how big it is. Because it brings new principles of healing that help us understand how to use what we already know better. So
Exactly.
yeah.
So tell us a little bit about what led you to the path of becoming a naturopathic doctor. What inspired you to follow this medicine from the people in your family that really went before you also?
Are you going to laugh? Because as a teen, I practiced with my grandmother and then with my aunt, who were naturopaths in Germany. My grandmother was also a medical doctor. And my aunt I remember being with my aunt, and a man came in with a blood clot in his leg. And so she sent me off to the pharmacy for a leech. And she promptly explained that the leech is injecting blood thinners directly into the clot so it can get more blood. And then it takes 3 days for a leech to dissolve a blood clot versus 6 weeks with the medication.
Interesting.
So those are the kinds of things that I was introduced to by my family. And I hated it. I thought, I'm not going to sit and listen to sick people all day. And I promptly went off and started to study Montessori teacher training. But at that point, was also struggling with my own health issues and burnt out and didn't finish the practicum. Then my father said, you need to go back to school and study something proper. So I bit the bullet and applied to naturopathic college rather reluctantly, and was accepted. And even third year, I wanted to bail. I was not happy, and it took me about 5 or 6 years in practice before it turned 180 degrees to I love this, and I haven't looked back since. I'm in my mid-60s now, and I'm just euphoric about getting out of bed and doing this work. Yeah.
And that's amazing. Like you
Yeah.
fought it for a while, but you can't fight destiny. So So tell us a little bit more about how you found German New Medicine and what interests you in that, because that's I like for me, I didn't actually even learn about it until I was living in Europe and somebody was telling me about it. And that's how I kind of started digging initially. But I think it's an important thing to bring to all the people here. So tell us a little bit about how you
Yeah,
found it.
yeah. Well, it originated in a little bit of tragedy in that my second husband was diagnosed with three brain tumors, and I didn't know German new medicine at the time, and of course had this image of these tumors eating out his brain, and we just went frantic. We were so afraid, and we finally did a 7-hour brain surgery. And then after that, one of my patients brought me Hammer's first book. It said, "You have to promise me to read this." And we were on our way to Germany. We went for treatments there as well. And I remember cracking that book at 1 o'clock in the morning and realizing this is not product. It's not a therapy. It's a whole new way of looking at disease. And it's what we've been missing this. This is why we're not having success with cancer. And we landed, and I hit the road looking for Dr. Hammer's a connection, and we sent him Mickey's brain CAT scans and had a phone appointment. And he told us Mickey's tumors were related to certain organs and certain shocks. So we knew the first two was heart and kidney. And then he said he also has something with his left testicle. And you probably won't know this, and it's some cell loss. And there were no symptoms of any of that. And I think Mickey was a bit offended. But after we lost Mickey, I had an autopsy done, and it showed the heart condition, the kidney condition, and a totally disintegrated left testicle. And
Wow.
that pushed me into studying this mysterious, well, it wasn't mysterious, this set of principles that actually made a lot of sense to me even then. And I remember having 7 pages of every line of questions. And after a year, most of those questions were answered. And I was blown away by what I was hearing from other practitioners and teachers, mainly Ilse-Dora Laker, and started using it in my practice and was purpley blown away by what I was seeing. Sometimes palliative cancer patients healing in one visit, just by reframing what they were going through, understanding it in a different way, and then writing it out. So by 2017, I published my book with cases saying, we need to use this. Like, let's do some research. Let's confirm this. Let's integrate this into our regular medicine. And it's still a track I'm on. I mean, it doesn't benefit that many people yet because it's so opposite to what we think we know about disease that most people can't do it. They're too afraid. And it's understandable. I mean, Mickey and I didn't do it well either at the beginning. It was just too different. But now it's like I've been doing it for 20 years or more, and it's just like breathing. It makes so much sense. So I'm
Hmm.
much more comfortable with it now.
Yeah, and it's a very powerful story too, how it really found you and then
Yeah.
how you saw the results. And really, yeah, I think it's pretty amazing too that then you're trying to prove the results and show everyone else really
Mm.
the power of it
On
as well.
yeah, on documenting everything. So, and this fall, I hope to start reaching out to local medical doctors and looking for doctors who are holistic and are looking for this material. I'm not going to try and beat on any walls, and just want to find people who want to do this. And
Hmm.
yeah, once we get a few, I mean, it would be very easy to research.
Yeah, and I think one of the like hurdles of overcoming it too is when a patient relates emotions to diseases, they think like they are to blame versus taking responsibility and going deeper. And so it's changing that mind frame too and removing the guilt or removing the blame and just going into it and not being afraid to go into it as well.
Yeah. I think that when the practitioner doesn't blame, when the patient really feels the sympathy practitioner has, they can They don't have to go into that blame. It's how we describe it, how we frame it. That goes a long way to how the person is going to take it. Yeah.
Exactly. Exactly. Um, so can you tell our audience, a little bit more about the history behind German New Medicine, about Dr. Hammer, and really kind of what he discovered too?
Yeah, I can. So his origin story is also rooted in trauma. He lost his youngest son to a shooting accident. And after he died, Dr. Hammer developed left testicular cancer. And he had been perfectly healthy. So made the connection that this trauma is related to my cancer, which is not new. We already were looking at that. I mean, we have been for ages. There's all kinds of research that shows that that's true. But he went a step further. He said, I'm perceiving this trauma with my mind, and I've got something in my body. Might we see something in a CAT scan that gives us clues? So he was working on a cancer ward in Munich, in a hospital, and he started taking brain CAT scans of all of his cancer patients. And he started to see these rings. Now, I don't know if you'll be able to see them. If I show you, should I try?
Yeah, we can give it a try.
Okay. Because these rings had been seen for decades, and radiologists used to think that they were reflections. So let's see. There. Ah, sorry. This probably is not going to work.
Oh yeah, yeah. No, that shows up well. We can see that
Okay,
there.
that's great. So, sorry, I guess I could have prepared for that. Uh, but he saw those rings in the same place for every cancer. So he went to Siemens, the CAT scan manufacturer, and he said, I think these rings are actually not reflections, but that they're lesions. And they proved that they were. And so we have that letter. And so then what he did, he started observing all his patients and finding out what kinds of traumas had happened and found out that there were similar traumas for each kind of cancer. And so that led to his first law, the iron rule of cancer, that there was always a predisposing trauma, which he would call a biological shock. And then as he observed longer, he noticed hundreds of new principles of how we get sick and how we heal. And that's the material that we call German New Medicine. But it's huge. I mean, it's like relearning medicine.
Hmm.
Yeah. So he's noticed all kinds of patterns. So I'll let you keep asking me questions and
Sure,
I'll
sure. Yeah,
slide these
because
patterns in.
so one of the most basic premises in German New Medicine is that most conditions are physical responses to biological shocks in an attempt to help us survive. So can you tell us more about what exactly biological shocks are and how you would go about linking them to a condition too?
Good question. So biological shock, by definition, is an event that triggers our fight or flight response, our survival response. And they're not only physical. Our mental diseases can also be understood in this way, which is very interesting and gives a lot of promise to mental disorders that we haven't been able to solve. And so what happens, well, I think I'll leave it at that. So Dr. Hammer emphasized that it's the worst when an event is unexpected and sudden. We haven't been able to prepare for it cognitively. It's almost like our primal body self reacts to it. And it's trying to help us with this event. So for instance, if it's a death fright, so we're told, okay, so you have a month to live. So what happens is that the lungs will grow more lung cells to absorb more oxygen to help us survive. We call it the lung program in German medicine. In regular medicine, this is called a lung cancer. And I'll have a story at the end about that.
Interesting. So it's
Hmm.
so
And it's
the
going to help.
biggest. Mhm. So
Sorry.
it's so it's more the unprepared, the real shocks, wherever that could be, where there's no in, information beforehand, and then it just hits, and
Yep.
then that really
That's,
creates that deep shock in the body, whatever that
yes,
could
that's
be.
the worst. You suddenly lose a job. Your spouse suddenly leaves. Somebody suddenly dies.
Hmm.
Yeah.
Yeah, and I mean, it seemed like he really figured that out in his own life too, having such an intense shock. He went down
Yeah.
that road. So the second premise is that for each condition triggered by shock, there are two phases, active and healing,
Mhm.
with completely different symptoms in each phase. So can you tell us more about these phases involved in German New Medicine and then what you might notice in a person during both of those phases?
Mhm. This is a core of German medicine, and it's and again, this is where it starts becoming counterintuitive. The first law isn't that hard to understand. The second law, so what happens is that when there's a shock, we get plummeted into sympathetic nervous system, fight or flight, and we'll have two sets of symptoms. General shock symptoms, which are cold hands and feet. We won't sleep well. We might lose our appetite and we'll be consumed by the shock. We might want to isolate, just in shock mode. Those are the general symptoms. But then there's also one specific thing that's responding to the specific shock. So in the death fright situation, it would be those lung cells specifically, although you wouldn't notice them at first. Often you won't notice the specific symptoms when you're in the shock phase. You mostly just notice that you're stressed because the specific symptoms can be quite varying, but there are two general categories of specific symptoms. One is cell growth, like this lung situation, but the other one is cell loss, like in a joint. Joints respond to self-devaluation. So I had a woman who, high level, very competent employee in the government, and she out of the blue got a bad performance review. Now, performance relates to hands, and what happened is that she ended up having arthritis in her hands so badly that she couldn't play golf anymore. And so when I told her, this is usually performance, she said, oh, I know the shock. But here's the kicker. You have the second phase, which starts when we resolve the shock. So in the example of the lung program or lung cancer, when we're not afraid anymore, when that's done, these cells will stop growing. It's not as we imagined that cancer is just a straightforward street. It totally responds to our psyche. And also, so then you're having also general healing symptoms. And in the healing phase, we're in parasympathetic nervous system. So we have two nervous systems. One's for stress, one's for relaxation, rest, restore. So when we're in parasympathetic, we have a whole different set of symptoms. We're warm, possibly fevers, might have headaches. The biggest thing about the healing symptoms, the general ones, is that we're tired. You can imagine that we're stressed for a long time, stress, and that the cortisol makes us hyper, gets us through the stress, and all of a sudden the stress is over. It's like the whole body just needs to repair. And so the body makes us tired so that we sleep because the body can't repair unless we're asleep. Even if our eyes are just open, the brain is totally involved in every little motion that the eyes are making. So, so then you have these general symptoms, which are headaches, because that lesion in the brain is also healing. So it's absorbing water. So you get kind of a full, possibly a pounding headache. not all headaches are that, but that's part of healing, specific one. And then you're hungry again, you're sleeping, but then you also get your specific symptoms are changing. So that lung growth will stop, and possibly if you have the right organisms, you'll actually have a lung infection that'll chew up these unnecessary extra cells. So sometimes you'll have a lung cancer healing into pneumonia. So it's tricky because
Mm-hmm.
I mean, we never linked those two before. And we never went, oh, this is great that you have this. You're on your way. Instead, it's like, oh my
Right.
gosh,
Yeah.
now, we need to, and it's not that we wouldn't give antibiotics or medication. We do that as needed. But
Mm-hmm.
we also see it in a very positive light, which changes how the person's going to respond to it. Now, in the case of the joints, that when that woman had that specific shock, the 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 cells in her joints started to erode or ulcerate, and it's asymptomatic. So when you're in the shock phase of a joint program, self-devaluation program, it's asymptomatic, except for feeling stress. It's only in the healing phase that you'll get the symptoms, because those ulcerations in the joints will then repair, and they repair with inflammation. It takes about 6 to 8 weeks. It's done. So what I told her, I said, I explained all of this to her, and I said, just if you're comfortable, go off your anti-inflammatory, which she was told she would need for the rest of her life. There's no cure for this. And she was playing golf that summer. Her hands totally healed because they just finished the cycle. There were two things that can, there's many things, but there are two main things that can block the healing. The main one is that when we get triggered back into stress, and of course, when you have joint pain, you're not performing as well. So you have to
Mm-hmm.
really get your head around this is a good thing, and I just have to rest my hands for a bit so that they can heal instead of, oh my God, I'm such a klutz, I can't type well. So that can be tricky. It's this isn't necessarily make medicine easier in some instances, but eventually that will stop. And in certain cases, you'll also have something, an obvious midpoint of the healing called an epicrisis, where the body will have repaired enough. And when we repair, we also retain water. And so there'll be a sympathetic spike where you might get some of your old symptoms back, which is exactly what was explained in homeopathy, the healing crisis. And then when you get through that, then the body takes the water out. So it's called the pee-pee phase. We pee out the water. And then you go back to normal. You've finished your program. And the main thing that we try to do is understand exactly where in somebody's life their shocks occurred and how do we help, how do we resolve, how do we think about them so that we don't get re-triggered by those kinds of shocks, so that we really end up with being more resilient and stronger on all levels. That's the optimal. There's the textbook process. Now, messy human beings were rarely textbook cases. I know for myself, I mean, I've known this material for over 20 years, and I'm still futzing around with some of my programs. It takes time
Yeah.
and effort, attention. So I have a lot of sympathy for people, that this is not easy. I don't expect people, first of all, to just accept this material. And then I don't expect them to all of a sudden be able to resolve things. People need a lot of support going through this process. And there are some people who just get it and they're off and running and they need almost no support at all and they come back and they're cured. So
Yeah, that's
those are
always
the
great.
people that show us that this is true.
Mm-hmm.
Yeah.
Yeah, and I can imagine a lot of people needing support when they're going through some of those phases and they're like, what is happening to me right now? How is this healing? And you have the ability to walk them through and tell them what's going on, I think, which would really help the process for them, but it could be hard when they're in the moment. going
Well,
through
the
that.
tricky thing is that half of our cancers are actually healing. So one of my first patients when I was when I was first starting to use this had ductal breast cancer. And basically that responds to a separation, but in the stress phase, there's an ulceration in the duct. And the ductal, what we call a cancer, is just a repair phase. So it's an overgrowth of those cells repairing, the cell
Mm.
loss in the duct, and stops by itself. So we figured out the separation. It was really clear. And I basically just walked her through all the healing symptoms, especially the fatigue. It's very scary for cancer patients to be so tired. And sometimes you have to be in bed. If it's a deep program, if it's been a deep shock, and sometimes you get flus and fevers. So just had to, but in 4 months that lump was gone. Now it was small enough to be gone. When they're bigger, they don't they don't heal as nicely. And then we have all kinds of issues in the healing phase for the different programs that we have to really be clear with people. Are you ready for this symptom and this symptom and this symptom if we go into healing? We have to be really careful with people who are afraid of the medical system and they just want to do German new medicine because they don't want to do their treatment. It doesn't work because we need we're not a German new medicine culture yet. We need to have our safety blankets.
Hmm.
We need to work together. This is not a
Right.
standalone system. Yeah.
Right. Yeah, I think that's kind of the tough part. Like there's always a balance, especially in this and
Mhm.
in this world. So it's finding when and knowing when to integrate both. And I think that's the real part of like being a physician too, is understanding when to use what and then listening to the symptoms properly.
Yeah. Well, over the last 2 decades, we've made a list of things that optimize people's healing. And I'll tell people, well, this is going to interfere. Let's see what we can do. And if they have too many things on that list, I'll say, we need to do both. You need to go do your chemo and radiation, and we can do this. We'll do
Hmm.
it in parallel. And that breaks my heart, and it's the most realistic thing to do. There's no question now in my mind that sometimes we need to do that until we're further along. Yeah.
Right. Yeah, I agree with that. I wish it wasn't that way, but it is. And knowing when and what they're dealing with, it has to meet with that level of treatment too. So it's kind of doing everything at
The
once.
nice thing is that I found that when people, even though they might have to do their treatment, if they do the inner work, the emotional work, they come out of it feeling like this diagnosis has been a blessing. I would never be who I am now without having had to go through all of this, being pushed through it. And that's so rewarding.
Hmm. Yeah, that part is a really beautiful thing.
Mhm.
So going into the next question, did we talk about like, I guess I can jump into more of like your clinical practice and you can give us examples of that too, like
Oh,
what you've
sure.
done in clinical practice or through the 5 laws and kind of go into
Yeah.
those as well. We can start with the 5 laws and then jump into your clinical
Okay,
practice.
sure. So the 5 laws are one, biological shocks create lesions in the brain, which trigger a part of the body to try and help us with the shock. If there are too many shocks on one level of the brain, it'll actually, instead of creating physical symptoms, it'll actually create mental, what we call constellations to preserve the body. Otherwise, we'd have too many symptoms. And so then we have these constellations which help us compensate for the shock. Like, let's say there's too much self-devaluation, we'll become what we call megalomaniac. I know everything. I'm good. I'm the best. It's actually very common on a spectrum, that because we live in a world that predisposes to self-devaluation. No one's really good enough. Yeah. So So the second law is the law of two phases. So you have the stress phase or the conflict active phase when there's a resolution, or if there's a resolution, you go into the healing phase. Sometimes you can get stuck in the conflict active. We call that hanging active. It's just being stressed all the time. You just never get out of it. And but people usually downgrade it. They manage it. But it's just always there. In the healing phase, we have more tired symptoms, warm symptoms, might be headaches, might be other kinds of pains. There tends to be inflammation. Inflammation is a healing mechanism. So when medicine and alternative medicine says, well, inflammation is the key to disease, it's not quite right, because it's not a matter of stopping the inflammation. It's a matter of resolving the shock that keeps the inflammation hanging, and then it goes by itself. But if you just try to stop the inflammation on its own, we're actually fighting our body that's trying to heal. And it can just keep getting chronic. And it can get so complicated and expensive with all these anti-inflammatories, natural and medical. And I rarely see them working. I see people on all kinds of things. And that's one of the nice things that I found with German New Medicine is I use a small percentage of the supplements that I used to use, that really makes me happy. I don't like prescribing a lot of supplements. And I've noticed that people in a lot of supplements are being irritated by them. So we have these ways of testing so we can decrease people's supplements, which they're usually pretty happy about. So the third law is I forget the way he describes it, but it correlates the kind of patterns we see in disease with where these initial shocks hit the brain. And there are two main patterns. One is the old brain, more in the back of the brain, the reptilian brain, more survival kinds of issues, life and death. That pattern is cell growth in the active phase, like those lung cells growing, and then stop growing and possibly get degraded by bacteria in the healing phase. The new brain pattern is ulceration in the stress phase, and then repair, growth, and inflammation in the healing phase. And sometimes you can have a tumor as part of that. And sometimes it's just inflammation and pain, like an arthritis. There's a third pattern, which is functional, which is like your diabetes. Your insulin goes down, and then in healing, it goes up again. And also paralysis. It's also a functional. So it's a motor conflict. You freeze in the conflict active, and then you have little spasms, and then they go away in the healing phase. And that's where you look at something like a Parkinson's is a stuck motor hanging healing. My teacher Ilse-Dora had 5 cured Parkinson's cases. It was MS can sometimes be in that category as well. So that's the third law. Depending on which brain level, you can know what kind of pattern to expect. So then when we get a condition, so let's say somebody comes with arthritis, we know that that's already in healing. If somebody comes with a lung cancer that's growing, we know that's inactive. So when it's inactive, we have to do something to resolve. When it's in healing, we have to explain what this means and help them ride out the healing symptoms and also identify triggers and resolve the triggers, or do something in their life that doesn't expose them to triggers. Dr. Hammer was very pro having practical solutions. So I remember there was a story of a man who had divorced, and every day he walked to work past his old house and saw his ex-wife with the new husband, and he was triggered every day. Dr. Hammer went, "Take a different path to work." He lost a dog, get a new dog. lose a spouse, go and get a new spouse. Like biologics, the biological solutions. So the fourth law involves organisms. So Dr. Hammer observed that different organisms were involved in the healing phase. And he went so far as to say, we only have infections in organisms in the healing phase. Because in the active phase, our cortisol is high and it protects us against infection, which is very interesting. And he correlated the different ages of the organisms. So our oldest one-celled organisms are TB bacteria and fungi. And those organisms would be evident in the healing phase of old brain programs. So for instance, in the lung example, it would be a TB infection. That would look like a pneumonia. And so he gave the example of after World War I was the first war when people were aware of what was happening in the trenches. And it was such a horrendous slaughter. There was so much death fear, not only of the soldiers, but also the families who could hear from the journalists what was happening. And so after World War I, there was a big TB epidemic. And that was everybody being relieved that the war was over. So it's interesting to be able to look at those things. Now, I look at that and say, we still need to do the research. I mean, it makes total sense to me. I see it in practice, and we need to still take those kinds of things and go, okay, let's prove it.
Mm-hmm.
The fifth law is that all diseases are significant biological programs. They all have meaning for the person or the species. So for the lung cancer, of course, it's trying to get more air in. I've had wonderful experience with ovarian cancer. So ovarian is like the testicular program in that it responds to loss, usually a death. And because the reproductive organs correlate to the new brain, they have the new brain pattern where there's an ulceration in the organ in the stress phase. When the death is resolved, that organ starts to grow back, starts to repair. And that's what we call an ovarian or a testicular cancer. It grows for 9 months, so it's in the pregnancy cycle. And then it stops growing, it becomes a cyst, and it keeps a high production of reproductive hormones because we want to conceive another being. We lost a being, we want to make a new one. We lost a mate, we want to be sexually attractive so we can attract another mate. So it fits somehow in some way. Now, some of the programs aren't as clear. And so we go back to possible stories, which may or may not be true. We really don't know. But there's typical German New Medicine stories. So, for instance, abandonment or existence fear have the same organ, the kidney. And what happens is that the kidney tubules will shut down and retain water. And the story is that it helps us get back to our tribe, that we have water and we won't dehydrate, I guess, on the way back to the tribe. So I don't know if that story is true, but I know that when we have people go into the hospital and they don't have their family there and they're frightened for their existence, that's when the kidney tubule kicks in. And in regular research, 70% of cancer deaths are from kidney failure. That's that pattern. And so we have a story where we have it several times actually, but one in particular where a woman was in the hospital. She had 3 cancers. She was healing them quite well. She was exhausted. It was too hot outside. Go to the hospital. They have air conditioning. Nobody was able to go with her. So the nurses were saying, Oh, have you got all your affairs in order? She said, oh no, I'm here. I'm working with a naturopath. There, of course, she's just taking your money. You are dying. And they was just over and over. They just told her she was dying. So then she calls me and I can barely understand her because her lungs have filled with water. Because Dr. Hammer noticed a certain pattern that when you have these existent spheres and the kidneys shut down, the water will go specifically to the areas that are healing. Those areas are already holding water. So it's kind of doubling the water. So her lungs are obviously healing. She had stopped coughing. She had all her lung symptoms were gone. So, so then you could hear the water coming through her throat. So I just calmly said, it's okay. You're not dying. I'm going to send your family in. Just hang tight. So I call her family. I say, this is what's happening. I talked to you, but I prepare families for this because it's very common. I said, go in, just reassure her. She'll be fine. So the next morning, I get a call from her. Hi, how are you doing? Water all gone. So I go and visit her in the hospital, and the nurses take me aside and they go, what did you do? We always lose people within hours of that point. What did you do? So
Wow.
you know,
Hmm.
it all fits together. You can, it's coming. All these pieces are like this big puzzle. We'll be able to do things we couldn't believe we could do. I mean, I've seen dementia patients, reverse through using this. Now, not all can, and maybe not many can, but when you see even one reverse, you go, okay, this is possible. There was the same kind of pattern, abandonment, and then the brain holding too much water. It just couldn't think straight. Diagnosed with dementia, came out of where they felt abandoned and everything cleared, totally normal. So this is what teaches me. These stories
Hmm.
are what teaches me. I will do nothing based on the theory if it doesn't work in practice. And this has shown me, my patients have shown me over and over and over again. I'm still astounded at what I see 20 years in.
Right. Yeah. It seems like one of the most important things is just counseling them through these phases if they're in that time. So you're
Totally.
not triggering them more, but calming
And
them
you can't
down.
always do it. And you can't always do it. Sometimes you'll get people who are absolutely not able to do this. And then we lose them.
Mhm.
I mean, most of the people that we lose are palliative and expected to die. But I've seen enough palliative people pull out that I take them anyway. Like, okay, let's give this a try, you know? And
Mhm.
and we do a lot of death work. So we really, really help people make peace with dying. We help families make peace with dying. I don't charge for that. It's a beautiful part of my work. It's a sacred part. Yeah.
Yeah.
So even if I can't help them survive, uh, I, I just feel like from a spiritual perspective, dying well is one of the best things we can do in
Hmm.
this human body. I don't have any particular spiritual path at the moment, just studied lots of different things. Yeah.
Yeah, that's a powerful part. So it's
Yeah.
amazing you're doing that work too. It's hard work also, but very
I love it.
beautiful.
It's not hard at all for me.
Yeah.
When I lost my husband, I don't know, it's too much of a tangent. That's a whole other story. I gotta get sidetracked. I'll stop right there.
But yeah, no, I understand that point too in a
Sidetracked.
deeper sense. Um, so can you give us some more examples, kind of like in your own knowledge or clinical practice or different interesting cases you've had? And also something that I'm kind of interested in is once you find that issue,
Mhm.
how do they go about resolving it too? Is it just they recognize it and it
Yeah.
removes, or tell us a little bit about that too, because I'm interested in that
Okay.
process.
Let's start with that. So there's a huge spectrum, I think in most things with medicine, where you get the textbook cases, which are easy, and then you get impossible cases. So when you have people who've had recent shocks, And there are people who are fairly balanced in their ego. They have work, they feel pretty good about themselves, might have a good relationship, they had a good family background. Those are fairly easy to resolve. And what we do is we use the premise of somatic therapy. We use the premise that these shocks are stuck in our bodies. That you can, if you want to talk about your shocks from here on, you can do therapy for decades and you can manage them. They'll still be there, triggerable. But if you can breathe into them, if you can use EFT, which is tapping on acupuncture points, EMDR, which is the eye movements, I mean, the whole somatic field has mushroomed. I mean, I usually refer for this kind of deep work for people who've had deep traumas. They usually need to do somatic work for a while. And it's a matter of feeling safe in their bodies. And how do we help people feel safe? I'm still doing my own trauma work, so I don't do trauma work with people. But I've seen people resolve things in one visit, easy. And I've seen people who could not resolve. It was too painful to go there. They would rather die. It would just blow all their fuses. It's just like searing pain, like touching a hot iron. Cannot do this. And I know that from the inside out because I used to be like that. I couldn't touch my own pain. It's taken me decades to be able. So again, I have a huge sympathy for that. There's no blame. It's just sometimes too hard. It's like taking somebody to the gym and say, okay, lift that 500-pound weight. You can't do it. You have, those of us who spent the first half of our lives avoiding our pain, lost those muscles. We didn't develop emotional resilience. We have to develop it. It's not realistic sometimes, and maybe even often, because we live in a culture of how are you? I'm fine. Nothing else. Everything gets shoved. We get people who have no idea what's down there. I run a group twice a month to just practice healing work. And in my last group, I had the visualization. Okay, it's like going into a jungle. You're actually disoriented. You can't even make sense of what's up or down. It's all just dark with scary noises. So I think that we as a healing community need to really work on how to make this more possible, how to make this easier, how to make this realistic, how to make it fun, how to make it going to the gym and lifting weights fun. Yeah. So, and then there's also the situation where sometimes you can't find the shock. So then, but of course, by the symptoms or by your condition, you know what kind of shock to look for. The brain lesion, the condition, and the shock are always the same, according to the German New Medicine. And I'll always say that, according to New Medicine, German New Medicine, we're looking for this. I'll never play God and say, this is for sure, even though I might feel it. It's not our reality yet. So I need to be careful with that, to give people room for thinking differently. I don't want to put them into that box if they don't want to go there. It doesn't work. So they have to see things for themselves. So basically, if somebody, let's say, has the joint pain, they somehow had a devaluation related to performance, and they can't remember that. And we just look at what are the current triggers that make you feel bad. And the current trigger might be the pain in the hand. So then we work with what's now in those same somatic ways, cognitive ways, using tapping, using breathing, learning how to talk to ourselves in a different way.
Yeah, no, that's really powerful. And I wonder, like, if some of these shocks happened during childhood where they suppressed the memories, or it was so early on that they don't even know really where it came from. Then I guess you would go and look at the current triggers or try to
Well, I
dig.
have an interesting story about suppressing shocks. I had somebody come in their 20s, a young man who had psoriatic arthritis, which is an old person's disease. And as a naturopath, I'm looking for cause. This was before I knew German medicine. And there was nothing. Like he was totally healthy, except for the psoriatic arthritis. And I thought, there's a trauma in there. I said, where are your traumas? He said, I've had no traumas. I have this great family. I love my work. I have a great group of friends. I went, I don't think I believe you. So I treated him, symptomatically with homeopathy. And 6 months in, like once a month, I'd say, you remember anything? 6 months in, he comes in, he's white as a sheet. And I'm thinking, finally, something's coming up. He said, I saw him yesterday. He said, tell me, the guy who beat me up. How old were you? 14. The guy went to jail. There was a court case. He didn't remember 10 years later. It took six
Oh,
months
wow.
and him seeing the person. That was a huge, huge lesson for me. My hair still stands on end when I think of that. How well we can suppress things when they're that painful.
Mm-hmm.
Yeah. So we have
Yeah.
to be, so then knowing that, I'm very gentle. So then we have to be careful if the shock isn't forthcoming, maybe we just need to just dance around it for a while, make the person feel safer and safer, and kind of we call it downgrade. And then the healing symptoms are much easier as well. Yeah.
Yeah, you have some amazing stories and a lot of very interesting cases when it comes to
Yeah.
German new medicine.
Yeah. Yeah. I'm amazed.
And it seems
Yeah.
like, yeah, you have to work a lot as an investigator too, to try to get those things out of people and
Mhm.
find the source when you can.
Yeah.
I think.
Well, one of my most satisfying cases these days is a middle-aged man with the same kind of brain cancer that killed my husband and my sister and my mother, glioblastoma.
Okay, yeah,
And
that's what my father had too.
okay,
Hmm.
so he came and he'd already had all kinds of treatment and been given up palliative. And so when I explained the German medicine aspect, got it immediately, said, I'm getting out of this. So we've been working together to clarify the shock, make sure there aren't triggers, and very, very gradually help him get off his steroids, but so gradually that his body's, to allow, because when body part is healing, just to say again, it's going to hold water. So, of course, in this closed cavity, that is going to trigger all kinds of pain, which triggers fear, which triggers more water through the kidney tubule, existence fear, and we lose people. So we went through all of that, explained all of that, how we're going to go so slowly that we're not going to trigger that. So it's been 6 months. We're almost off the steroids. Has no symptoms. So we're not
Wow.
through yet. We're not
Hmm.
through, but I am so hopeful because we just needed one glioblastoma case using German medicine. There are other people who've healed glioblastoma
Hmm.
in using different things. But of course, you can use other things. If you're using something, like let's say a keto diet, and you really have a lot of faith in it, and you kind of relax around that, it's going to allow the brain to heal. You can use anything. It's a placebo
Hmm.
because not everybody, otherwise, everybody who had glioblastoma would heal with the keto diet. They don't. It's a small percentage.
Hmm.
So now we can understand, and we can understand how to use placebos for people. If it's too much to go German new medicine, you can use an obviously indicated therapy, the product. But in the back of your mind, you're going, just need to relax into this. You're different. Use a lot of positive, feedback, and you're getting them through the healing process, unbeknownst to them, using also the German new medicine principles.
Right.
And you're doing, valid therapy. You're
Hmm.
doing exactly what, maybe with a few less supplements, a few fewer supplements. And now
Right.
we don't have to do the diet quite as I mean the diet in German New Medicine is a basic, healthy, balanced diet. Nothing rigid, no coffee enemas, no juice fasts, no, except for small periods of time, but not for these long stretches. People get totally depleted.
Hmm.
You need more protein when you're healing. I'll
Right.
often put vegetarians, I'll say, can you eat meat for a while? I mean, I like vegetarian diet and tribes, when people were sick, we eat organ meats. So, and I'm sure that as we get better at this, we'll also be able to find ways to do this and stay vegetarian. So it's all to be figured out.
Right. But
Be great.
yeah, I know. I
Mhm.
I could listen to your stories all day long. It's really interesting, and I think it's such an important element to reframe people's thinking and to tie the emotions and the body together because they're deeply connected. They're not separate entities where
Yeah,
you treat differently and address one and address the other because it's so clear how deep everything is, whether it's them thinking that this is going to work and so it works with a placebo or having emotions and going and causing so many different things. So yeah, I think German new medicine has a lot of potential in treatment for sure. Well, thank you very much today, and thank you so
it
much
was
for
a
sharing.
pleasure. Yeah, you're a wonderful interviewer. We're looking forward to this.
Uh, yeah, thank you so much. And we'll be sure to put up your website and all your information too, so everyone can find you and
Yeah,
reach out as well.
sure. Yeah.
Okay.
Okay.
Thank you
Thank you
very
yourself.
much. Bye.
Okay. Bye-bye.